我哋夠鐘亦。
Colleagues, it's time for us to start, and we've also formed a quorum. We can start today's meeting. Today, we have to see whether we need to elect another chairman and deputy chairman. Do you think we need to elect another chairman? Mr. Cheung Kwok-chi, Mr. Chairman, I think if we have the same chairman, it will be more consistent for us to oversee the issues discussed. Mr. Chairman, I support Mr. Cheung Kwok-chi's comment. So thank you very much for your support. Mr. Tan Ka-pyu and I will continue to be the deputy chairman and chairman respectively then. Today, we are to discuss the Respite service for the elderly and persons with disabilities, PWD. This is very important because such services are in acute shortage, and the elderly and PWDs have to wait for a long time. And then their family members find it more and more difficult to take care of them. So we have an urgent need for such services to be enhanced. If we have stable and adequate respite services, then the family members involved won't need to worry so much, because if they're otherwise engaged, they know that there are institutions to take care of their family members. And of course, these elderly and PWDs can continue to stay at home, but if they cannot be taken care of by their families, they can be taken care of by certain institutions. So this is a very crucial issue. In the past, we were very dissatisfied with the respite services, both in terms of quantity and quality. We also received complaints to the effect that certain institutions had been picking their customers, so to speak. So we welcome the representatives from the administration. We have Mr. Stephen Hsu. Well, it seems that today you're also feeling unwell. I wish you quick recovery. And then we have officials from the Labor and Welfare Bureau, the Social Welfare Department. Mr. Hsu, perhaps you can briefly take us through the paper, and then the deputations can speak. Well, Mr. Chairman, perhaps I should briefly introduce the respite services, and then our colleagues can supplement on the elderly services. So thank you very much, members and deputations, for attending this discussion. We agree to your views. Our rehabilitation policy is that we should provide sufficient support to the elderly. So respite services are very important. At the moment, for the provision of respite services, we rely on specified places and occasional places. We have 248 residential places at the moment. And for daycare, through our 16 support centers, district support centers for PWDs, they're providing services. For the seriously disabled, respite services are particularly important. In March 2011, we already launched the home care pilot scheme. And then starting from March 2014, such services will be rationalized. Whether or not you're queuing up, you can be provided with the services. And home care is also provided. Members are very concerned about this. We understand that there are concerns about the services provided to those aged between 6 to 14. Members are worried that the services might be terminated. I can assure you that the services for those aged from 6 to 14 will continue. The SWD has already informed the NGOs concerned and will confirm the details with them shortly. There's a huge demand for such services, so we won't just maintain the existing services. We're discussing with NGOs and other organizations to see whether we can improve and enhance the services. And we're striving for additional resources, for additional places for respite services and daycare services. So thank you very much for attending today. In terms of demand and quality of respite services, we're very willing to listen to members and deputations so that we can continue to improve our services. Mrs. Chan, any supplement? Thank you, Chairman. First of all, I'd like to thank so many deputations for attending this meeting today. Let me introduce our respite services for the elderly persons. We understand that the elderly would like to age in place. That's their wish. But it calls for a great deal of effort to take care of elderly persons at home. Apart from community support for the elderly and counseling and support services for the carers, we also provide respite services to allow those needy elderly and family members to place their elders with the institutions so that family members can do something else. Now we have daycare service as well as short-term residential services. They are provided through service centers and other units. We at present have 123 day respite places at these subvented daycare centers and units for the elderly, that is DEs and DCUs. And for casual vacancies, they can also be used for respite services. And there will be new daycare centers, and the number of respite places will be increased. As for residential respite places, we have 11 designated residential respite places. Understand that 11 is really too few. But at the same time, throughout the whole of Hong Kong, for all our subvented residential care homes for the elderly, the RCHEs, and contract homes, as well as private homes with bought places, there are casual vacancies to provide respite services. So the number is much bigger than 11. In Hong Kong, with more and more elderly persons, so we're badly in need of such respite places. So today we're here to listen to you to see whether or in what way we can further improve our services. So I'll invite the deputations to speak. Now, deputations or individuals, please pay attention to the following reminder. Your verbal and written remarks will not be protected by the Legislative Powers and Privileges Ordinance. That means you have to be responsible for your own remarks. As our time schedule is tight, I can only give you 3 minutes each. So please grasp your time well. First of all, Mr. Yip Wing from Labour Party. Yes, please continue. Well, maybe our staff can help move the microphone nearer to him. Yes, thank you, Mr. Chairman. I'm Yip Wing from Labour Party. Respite services are for temporary care to be provided to the PWDs when their family members are otherwise engaged. For most time, family members have to take care of the PWDs. So there is an urgency for enhanced respite services. We have a 14-page checklist for such services. But each institution only have 2 to 3 casual vacancies. One of them has 12. Many of these institutions are cross-district in nature. I did personally call them up to inquire about their services. They always told me that I should be assessed first. On the 17th of October, I asked whether there's a place on the 30th of October. I'd like to apply for a residential respite services, but the soonest slot will be on the 19th of November only. That is a month later. Let me ask you this. For an elderly parent, if they fall ill and is hospitalized, there are no siblings, no relatives or friends to take care of the PWDs. How can they wait for a month? How can they call up each and every institution to see whether or not there are casual vacancies? There are 14 pages for the list of institutions. Mr. Chung Kwok-chi asked the CE during the Q&A session about a person 90-odd years old. COI also said that Hong Kong is such an affluent society. Why is it that some elders don't even get a space? So I'd like to have enhanced respite services for these PWDs so that the family members can take a rest. Elderly persons are followed up by social workers, but PWDs have to make telephone calls themselves. So the case manager scheme should be launched as soon as possible so that there's a case manager to follow up on each and every PWD. That will shorten the time required for telephoning. Then PWDs won't die as a result of their illness. Well, every person will age. Every person has a chance of being disabled. That's the case with our commissioner today. Next, Ms. Chan Fong Tai from SME Global Alliance Elderly Services Limited. Good morning. I represent the SME Global Alliance Elderly Services Limited. The theme of this discussion today is respite services for the elderly persons and PWDs. As our hospital resources are very tight, hospital resources are reserved for those with acute and emergency needs. But there are certain persons who have not recovered to such a state that they can take care of themselves. But when their children, for example, have to be on business tour, if they're out of town, then there's a need for respite services. I understand that at the moment, the government has tasked NGOs with this service. Starting from last year, those institutions would bought places. When they have casual vacancies, they can also provide respite services.
So I'd like to ask the question, can private care homes also provide such services? Because for the enhanced workplace scheme for grade A places, I'm also applying for the scheme, and they have professionals like speech therapists and pharmacists and occupational therapists, etc., etc. I hope that private care homes can also provide the services. Of course, assessment can be made, and for homes under the Enhanced Workplace Scheme, actually, we provide 99% of the places provided in the homes can be open. So I think private homes can also take part in the provision of this service. Then I would like to talk about the manpower problems in private homes. Yesterday, Mrs. Carrie Lam made an announcement on the population policy, and I can say that we are flexible in terms of the working hours, etc. And we'd like to mobilize women in society to go to work as well as take care of their family. We allow them to be flexible in terms of their working hours and the number of hours worked every day. And still, we are having a shortage of manpower. So for the sake of our elderly people and our future, please pay attention to services for the elderly, because we need manpower. Thank you, Ms. Chen. Next, Mr. Thomas Kwong from Hong Kong Private Nursing Home Owners Association. Chairman, just now, Mrs. Chan from the Labour and Welfare Bureau made the presentation, and in fact, according to the information for females, there were 250 places, and for males, 140 plus places. However, all these places are situated in areas like Yuen Long, Chuen Wan, Kwai Ching, etc. And where do we see the keenest demand? I hope the SWD will not just cite these figures to defend themselves. And like Mrs. Chan just said, we're talking about helping the elderly people today. And I hope that more places can be used in private homes as respite to provide residential respite services. It is impossible for elderly people to go across several districts to reside in a home for several days. And there are 2 homes in Hong Kong, 4 in Kowloon, and some others are all in the New Territories, among the 11 of them. And we need professionals we need dedicated staff to look after them, and this will impose extra burden on the staff of the homes, and we're already having a shortage of manpower. It's difficult to find good staff. We can hire laborers, but are they really suitable for to take care of our elderly people? So it's a question of deploying suitable resources to help the elderly people. I hope the Social Welfare Department can consider it, and the Labour and Welfare Bureau can also consider this point in terms of money, in terms of manpower and legislation, and taking into account all the circumstances, what they can do. Don't just cite some figures telling us how many homes you have. It's not helping the elderly people. We hope that by doing so, we can help, and we can then also cite figures to the SWD to tell them that how we're helping the elderly people, and so that when elderly people come here for respite services, they know what help they're getting. We don't know what unknown illnesses the elderly people are suffering, and we need to protect the elderly people residing in the homes as well. So it's difficult to help our elderly people if you only cite figures. Thank you, Mr. Kwong. Next, Ms. Poon Pui Kam from the Muscular Dystrophy Advocacy Group. Good morning, everyone. I am a patient suffering from muscular dystrophy. I agree that short-term or respite services should be enhanced and I think the service should be more accessible. I live by myself. I'm a retiree, and I rely on my foreign domestic helper to help me with household chores. And at night when I sleep, I need a domestic helper to help me just to turn around. But it's difficult to hire domestic helpers now, and they can work for another employer easily just by going on a trip to Macau or mainland. And my helper is actually quite good, but she said that she wouldn't want to renew the contract with me because she would like to get a more comfortable job. So it's very difficult for me to find a helper because I need help in every aspect. And she needs to go back for 3 or 4 weeks. Even in ordinary times, every week, whenever she is on her day off or on leave, it's very problematic for me because I need to wait for a domestic helper to help me clean my home and also help me dress. And once I hired domestic helper, and she came 3 months after she came, I discovered that she had a miscarriage. If she had had a baby, I wouldn't know how I could get help. And they are protected by the employment law. I cannot sack them easily. So sometimes even employers need to pay compensation to the employee so that they can hire another helper as soon as possible. And even the agency told me that I should hire a domestic helper from Indonesia. For those already in Hong Kong, they may only work for a short while before they change to another job. And I'm also a retiree. I need to be careful about how my money is spent. So I really like to be self-reliant. I don't want to apply for CSSA at this stage. So I have several suggestions to the government. There must be more respite places, and there should be more resources to train the manpower needed to provide the service. As for the quality of services, they vary, and I think the government should formulate measures and regulate the sector and to study ways to plug the loophole of foreign domestic helpers escaping the terms of contract by leaving the territory on a short-term basis, so that they won't switch jobs so easily. Next, Ms. Chen Fong Man from the Multiple Sclerosis Group. Good morning, I'm Chen Fong Man. I suffer from multiple sclerosis. This disease or this condition is incurable. My situation deteriorates every day, and I have mobility problems. I need to rely on walking frames, and I need help. Even when I cook, when I stand, when I walk, I need help. I even need help when I sleep. And my daughter needs to go to school, my husband needs to go to work, and I tripped over in the toilet, and I live with my family, so I only receive disability allowance. When I'm home, well, my family is worried that I might trip over, and they hired a foreign domestic helper to help me. And I really need a helper. but there are immigration problems, and the helper hasn't arrived yet. I hope in November, I hope by November the carer can come. In 2010, the medical social worker referred me to a society which provides help to me. There is a meal delivery service, and I was helped with showering 2 times a week. It's impossible for me to hire helper full-time because of the high wages, and they can't stay at my home around the clock. So I hope that the government can provide subsidy or allowance for hiring domestic helper, and to protect the interests of employers so as to provide better care to the community. Next, Ms. Seiso Jitana from Hong Kong Neuromuscular Disease Association Limited. Thank you, Chairman. We are a voluntary organization helping those suffering from neuromuscular disease and their family members. This is an incurable disease, and this is also a degenerative disease. The patient may be able to work in the beginning, but the physical condition deteriorates, and very often they need to rely on domestic helpers to help them with their daily living, and the disease will degenerate to such a degree that the patient may not be able to eat by themselves, etc. And the foreign domestic helpers cannot help them. Or they must be hired to help them, because they may be relying on breathing machines. So helpers need to provide care around the clock. And I encountered some cases. Some foreign domestic helpers would terminate the contract prematurely, and the family members need to provide around the clock care. And now there is a service provided by the Jockey Club Rehabilitation Center, but there are only 2 places. Sometimes it's not easy to secure the service, and family members are very worried. As for services provided at the community level, they only cover bathing service or house cleaning, and there are no residential places. So family members really suffer. I hope the government and the SWD in particular can take note of this point. There are many patients living in the community. They don't want to stay in hospital for a long time. They'd like to be with their family members because they cherish the times with their family members. However, as far as the supporting measures in the community are concerned, they suffer, and they impose with a heavy financial burden, and these problems aggravate their burden. We have a submission. I'm sorry I am a bit late. I only emailed this submission to you this morning. We'd like to enhance the service or essential care home services, and some deputations talked about the quality of foreign domestic helpers. So I hope you will read my submission and follow up on the points mentioned. Thank you. Next, Ms. Ho-Po Ching from the Fourth Right Caucus. Good. Thank you, Chairman. Good morning. Well, in April, we shared our views with you on the types of home services provided, and respite services is really very important support measure for carers. In the paper, it said that there are 248 places, and 80 provided by 87 organizations. But I am concerned because the 240 odd are all for PWDs.
Only 60 are so-called designated places. 183 are only casual vacancies. They're provided on an irregular basis. So 183, that is 2/3 of the places, are provided not on a stable or regular basis. That's really too few. There are only 60-odd standing places, and some of them are for serving the children between 6 to 14. But if you tell us that those places for children are to go in March next year, then even though you told us there will be recurrent expenditure for those services for the children, and I am pleased to hear that those services for the children will not stop. Now, you cannot just provide casual vacancies. If you have recurrent allocation for the service, they shouldn't be casual vacancies. Only 65 are standing places. As my neighbor Mei Ying mentioned, the Jockey Club Center had a lot of tragic stories. I really don't know how to tell all of them. It's really too time-consuming. For the tetraplegic, you really need to give them a rotation door system. If the carer is under operation or otherwise engaged or hospitalized, then these patients will have to be institutionalized again. So let me repeat, for the support network for the PWDs, respite services are really very important. So you have to increase the number of places. In particular, for the special schools, they have hostels. So if a school child has respite service, then it should be provided with temporary respite service within the school hostel. For the district centers, a case manager should be there to provide referral services on respite services. And for the tetraplegic, very seriously disabled, they should be provided with a case manager. So please read our paper. Next, Mr. Lee Wai from 香港安老服務協會政策研究組. Mr. Chairman, 78% of those providing respite services are our members, and 90% of those institutions with bought places are also our members. I quote these figures to tell you that we're representative enough. On the 28th of May, I said here that the administration's the institution's response to respite services were very, very poor, because the administration require a particular residential rate or attendance rate, and respite services are not counted. But these services do occupy our beds, so our institutions have to run the risk of being underutilized. So they don't want to provide such services. There are 500-odd casual vacancies. When I raised the concern, the administration said that in the latter half of 2012, over 200 elderly persons did use the places in the institutions. All right, 500 residential places, 200-odd customers. It sounds quite good. But within 12 months, there can only be 42 residential days. Say if there are 299 elders in the latter half of 2012, they stayed for 42 days. That will only give you 12,508. But the average is 500. Well, 500 times 180, that means 90,000 days. 12,558 within 90,000. That's 14% only. So you may say that there's no need in Hong Kong for respite services, or there's a redundancy, or the relevant policies are not supported by the industry. The industry would like to have vacant places rather than provide respite services. So here, I'd like to urge LegCo members to obtain two information for us. For the first half of this year, how many residential days the elderly spend? And then what about the average number of places per day? With the two figures, you see to what extent the administration is committed to the services. The respite services are so ineffective because there's a lack of support from the industry. But then the administration must do more. For public interest's sake, respite services must be counted within the bought places. Next, Mr. Lee Chi-yong from the Association of Parents for the Severely Mentally Handicapped. For respite services, when family members are hospitalized, otherwise engaged, or have to go out to work, then respite services are a choice. We conducted a survey. About 50% of those surveyed require the services. For PWDs below 15, the problem is acute. This is in Annex 1 of our paper. Please refer to that. In the SWD's paper, only 38 places are provided to mentally handicapped persons under 15. And for those who require high degree of care, is really more serious. On the 23rd of May, 2013, or April 2013, we already mentioned this concern and repeatedly asked the officials this question. Still, we don't see any improvement. With no choice, parents have to choose private homes or even hand over their children to those relatives on the mainland. Our parents are really exhausted. In a moment, we'll have parents telling their personal experience. I hope you'll listen to them seriously. As for support for students, at present, there are only 6 schools providing places for those seriously mentally handicapped for 6 days only. So we would like to have comprehensive support services for the students. And during long holidays, residential and respite services are badly needed. District support centers do not have enough places. They're not for wheelchair-bound services and for those who need serious care. According to the 2 United Nations conventions, the administration is duty-bound to provide to PWDs and their carers relevant support. So we request the government to increase the number of respite service places. And then there should be a central database, an information system for exchanges on difficulties. And then for school children, they should be taken care of in their home schools. And a dedicated team should be set up to follow up on the PWD so that we don't need to go everywhere to see how parents can obtain support for their children. Next, production team of documentary Independent Living of Disabled Community, Mr. Willie Kwong. Mr. Chairman, previously we produced a documentary, Independent Living of Disabled Community. We asked PWDs what problems they have in the community. We intended to show you part of that documentary, but we don't have enough time. So let me tell you part of it. Akyu and Meiwa are seriously handicapped and they need electric wheelchairs. Now they're living independently in a Kwun-tong PRH estate. Every day, Meiwa prepared lunch and dinner for Akyu. Given this living pattern, they've been living like this for over 10 years. You ask a question, if Meiwa is otherwise engaged, what will happen? In the interview, Akyu told us that number one, she won't go to a hostel. Second, she will be more careful in going out to dine. well, be it Argue or Mei Wah, were very worried because Argue is in a serious condition. She has to be very careful even when she's sleeping at night. She may slip down from the bed. So, given their experience, we know that respite services are very important to these people living in the community. Number one, would like to have a district-based respite service. Be it Argue, Mei Wah, or any other PWDs in need, they can have more respite services in their own district. In order to attain this, I believe the administration has to study the demand for respite services in each district, how to provide flexibility for such respite services. Besides, for the duration for respite services, if Argue or Mei Wah goes on holiday out of Hong Kong, then we have to assess for how long they have to stay in an institution before going back to independent living. Number three, procedures. We don't know when we'll fall ill. I won't tell 1 month in advance that I'm going to fall ill. So for applicants with sudden needs, can we shorten the duration of processing? Number four, we should be more humanized and more human rights based. IQ emphasized that she didn't want to stay in an institution, mainly because she's a human being. She doesn't want to live like a machine. She has to wake up at a specific hour, eat at a specific hour, otherwise she'll have to starve. In terms of space design, the institution should suit the needs of the PWDs. And then finally, sound follow-up. There should be a case manager to record the services and needs of the PWDs and the communities involved. Thank you. Hong Kong Red Cross Princess Alexandra School, Mrs. Charles Yua. Thank you, Mr. Chairman. I'm the school social worker of Hong Kong Red Cross Princess Alexandra School. We're a special school with a hostel, but we don't have respite services. Some organizations did propose to us whether or not during the summer vacation, when some of our students are not staying in our hostel, we can provide respite services to ease the burden of certain parents. Some organizations did propose that. Well, the organizations should continue to strive for this. In our school, we do have some students who are not residential students. But then when something happens in the family, they immediately approach us. As our former speaker said, even after making telephone calls for a day, you won't be able to get a place. In one case, a student came from a single-parent family. The mother didn't want to receive CSSA, and the grandmother was responsible for taking care of the son. But the grandmother suddenly was hospitalized, so she was very worried, and she approached us. Not every school hostel can have a place. They have the mentally disabled and the physically disabled. So we don't have that many places as you imagine. In many cases, places are reserved for those so-called long-term customers. So it's very difficult for us to find temporary places or casual vacancies for our students. And just now my neighbor said, we should look at the demand in each and every district and adjust our services. And in that case, eventually, that mother resigned in order to take care of her child at home. So our society is one worker short as a result. That's not what we want to see. So I hope that we can have more residential respite places. For example, in the hostel of special schools, can they be opened up to the public during holidays so as to provide more places for needy students and PWDs? And just now, my neighbor also mentioned another point.
Well, when we look for home places, we might make many calls, and yet we might not be in contact with the person in charge. So if there could be a manager or case manager, or if matters can be coordinated by the government, then it would be better, because we spend much time in making calls and yet we can't find the person in charge and we can't find a place. So there is a need to review the situation. As for casual vacancies, this is also problematic. Sometimes we make the call and they say that we do have a place, but we may not be able to give you the place, and we need to worry whether we will be spending time talking over this place which we cannot get, and then we can't get any other place. So for casual vacancies, I think we need to review whether they are indeed providing the service, or we should be able to know whether we can actually use the place or not. Thank you, Mrs. Chow. Next, Mr. Hao Chung Sing. Good morning, Chairman, members. I'd like to talk about respite services for mentally handicapped children. I very seldom attend this kind of meetings, but I think I need to come here for the sake of my daughter. I need to let the administration and members know how much we need the service. I live in Kwai Tsing. I have an 11-year-old daughter who is severely mentally handicapped. I'm also a chronically ill patient. I have a 1-year-old son. But the problem is I also have 2 other children at home, so altogether I have 4 children. And during long weekends or during holidays, well, it's really a headache for me. I try to look for respite places, Qingyi Ma On Shan, even as far as Kwai Tsing, and I can't find a place, and sometimes I have no alternative but to let my daughter stay home. And recently I found a private home nearby, and they're happy to. I'm happy because they are willing to take my daughter. However, they charge us over $200 a day. We tried several times, but we couldn't afford it. So I, in the end, had to take care of my daughter myself. Well, as a parent, I am responsible for taking care of my daughter, but I am just an ordinary person. Sometimes I may be sick. Sometimes I may want to bring other children out to play with them, and yet I can't do that. I ask around for support services, and yet I can't access any of them, and I don't know how the figures are come by. And in fact, if you want to know more, you can call the parents directly. Finally, I hope that you can take action to respond to our demands and our needs. We really need the service. We are suffering. Thank you. Thank you, Mr. Hao. Mr. Cameron Fong from New People's Party. Thank you, Chairman. I think members as well as the administration have heard many comments on the shortage of respite services. According to the figures in 2009, there are 360,000 people in Hong Kong with disabilities, and 70% of them were taken care of by their family members. So there is acute demand for respite services. For carers, they need to work during the day, and at night they need to take care of their family members, and we've heard comments from other deputations. They suffer and they are very tired. So the New People's Party have three points to make in relation to help for carers. I think we all agree that the government should allocate more resources on respite services. And we heard from the sector that the government's initiative is actually not attractive enough for the sector. They don't want to allocate places for respite services themselves, and the government should review the situation and come up with measures that can incentivize them. And we don't want elderly people to travel across districts. So there must be a review on the varying needs of different districts before deciding how resources should be allocated to provide respite services at different districts. Secondly, we have not been providing sufficient carer training, and this can be taken up by NGOs at the district level. The other point is that we never unite the carers so that they can form a self-help organization, so that when they have time they can exchange their experience and skills, and also to share their experience with each other to alleviate the pressure. And sometimes, for example, a carer may become sick, and if we have this kind of organization, then somebody might help the carer for a day or two. This can relieve the pressure of carers, so there should be a self-help organization for them. And thirdly, the New People's Party think that the government should expedite the study on the carers' allowance. We understand that for those lucky ones, they might still be able to work, but for the less unfortunate ones, they need to give up their jobs to support or care for their family member around the clock. So the government should consider introducing new allowances to alleviate their financial burden. If we provide more support in the community, the carer will provide better care to their family members. Thank you, Mr. Cameron Fong. Next, Ms. Kwan Choi Ping from Tonghua Group of Hospitals, Lock Kwan District Support Center. The District Support Center is responsible for the support for PWDs in Hong Kong and the islands, and I'd like to talk about respite services and how much they can help PWDs. As said, we have 248 temporary respite service throughout the territory, but as far as the Hong Kong island is concerned, there are only 48. For respite places, well, there is no distinction between districts. Very often, you just grab any place you can find. So, for PWDs, they may need to travel far to the new territories or across districts in order to get a respite place. So, many of them can't even get a respite place. I think that, we need to understand the situation. For those living on the outlying islands, they are living in remote areas and they don't have any respite places in the outlying islands. They need to travel to the new territories or Kowloon to get a place which is very far away, and this is not appropriate. And the District Support Center also helps PWDs in finding places. And as said just now, we also have the experience of making numerous phone calls and ask for respite places. And the degree of disability has been matched with the types of respite places offered. And once we made over 30 phone calls, and yet we couldn't find a place for a disabled person. As for casual vacancies, as heard just now, a deputation said that some places might be reserved for the so-called regular or long-term customers instead. And I understand the situation is not because the homes are favoring these long-term customers. For the waiting time for even for urgent cases, it might reach a year. So some may try to stay on the home by continuing with the respite service. And why do we need to make so many phone calls? I think there should be a platform providing all the information on respite places across the territory so that the disabled can have this information and spare the time making phone calls to each and every home. And this will help the disabled in finding the service they need. Thank you, Ms. Guan. Next, Mr. Willie Law, host of Visual Impairment Television, online television for the disabled. Chairman. Today, I speak as a user of the service. On respite service, as pointed out by everyone, is in severe shortage. I'm talking about acute respite service. It is in great shortage. Very often I receive complaints from my friends or from people with severe disabilities. They may be severely physically disabled. They may also be suffering from chronic illnesses. I recall that in 2009, I went to a home of a patient suffering from renal disease who required dialysis, and the parents of the disabled became sick, and so respite service was needed for the disabled. And I made calls for 3 days, and no help was offered. So the final option was to have this friend hospitalized. However, admission to the hospital was only granted at the discretion of doctors. This is a very serious situation in Hong Kong. On the face of it, there are 248 respite places in Hong Kong. 65 of them are standing places for PWDs or elderly people. So on the surface, it seems service is being provided. However, it is still in great shortage. Patients can only be admitted or can only receive respite service on a selective basis. And there are complex formalities to go through. If we need temporary respite service, we need to go through the social worker and the assessment. And if if there is an emergency at home or an emergency situation with the carer, these kind of assessment will only hamper the help for those in need. Rehabilitation service in Hong Kong covers a wide scope. Care for the needy is a major problem. If the government is not committed in resolving this problem, carers would remain very worried, and they may think that the government has no responsibility in caring for us, because they may think that the government would like to see the family members taking care of there are services, but they aren't enough and they aren't effective. Next, Mr. Yip King Kong from First Step Association. Thank you, Chairman. Frontline staff just now mentioned how hard it is to find a respite place, and for us it is really a nightmare. It's not only that we need to make phone calls one by one, we also can have little hope in really finding help for those in need.
If you refer to the SWD list, although there are 80-odd institutions with 200-odd places, the number of places available to the wheelchair-bound, you see that there are only 10-odd of them if you make telephone calls. Take Changkwano as an example. I telephoned, and eventually only 3 places are available for the wheelchair-bound. Respite services have been in place for so long. Why is there no central referral systems to assist these people to seek places? If every day our colleagues have to call up each and every institution to see whether there are places, how much time is used on this? Our friend just now mentioned telephoning for 3 days. And there are certain users who are not mentally capable. Even for infirmaries and the Jockey Club Center, they don't accept such persons. But these persons with no mental capacity are badly in need of such services. And then we have this 14-day requirement. If your domestic helper has left for 30 days, can you guarantee that your family member will recover in 14 days? So that's really unrealistic. And in certain cases, this 14 days really mean less. And very often, the waiting time is long. By emergency, they mean a place to be provided on the same day. But then, in certain cases, preparation for 2 to 3 weeks is required. Has the administration thought of these issues? Number one, emergency places must increase in number, and overall places must also increase in number. And then the 30-day and 14-day restrictions should be abolished. And then we must have a central referral system. There should be a referral system to allow frontliners to know in which district there are available places for example, the wheelchair-bound. And then there must be a case manager scheme. The case manager must have the power to order the provision of certain places for the PWDs, rather than having our frontliners doing telephoning so frequently. Next, Mr. Zhang Kai-sang. Mr. Chairman, this year I had used Respite service, so I'm a beneficiary. My ceiling had spoiling. Renovation workers came and said that I had to leave for 2 weeks so that my furniture could all be put on my bed and the ceiling could be repaired. So I sought help everywhere. Other people telephoned. I also made telephone calls. Service centers also helped me. And the center in Ma on Shan originally said that there's no place. Eventually, they said that a person had booked a particular place, but that person would move in a week late then. They asked whether I would like to take that place. Of course, I said yes. But repair works took 2 weeks in my home. I got only 1 week. I didn't know what to do after that week. Well, after I stayed there for a week, the nurse told me to go because the person who had previously booked the place was to come. She gave me dozens of telephone calls to ask me to seek help, and the nurse there was willing to assist me to make telephone calls. Well, after going through many institutions, she got one in Tin Shui Wai. I lived in Choi Wan. How could I go to Tin Shui Wai? And then the Tin Shui Wai staff told me that once I went there, I had to stay there. I could not leave. And then the Ma On Shan institution nurse told them that I had an electric wheelchair. I could go everywhere. But the Tin Shui Wai institution told me that I could not leave once I entered that institution. So what happened? I eventually gave up. I'd rather sleep on the floor of somebody's home rather than going to Tin Shui Wai. Well, don't ask me to go from Choi Hong to Tin Shui Wai in order to get such a residential respite service. And then when I was in the Ma On Shan institution, somebody told me that he had been there for over half a year. Why should somebody stay there for half a year? I was only looking for 2 weeks, but in vain. Next, Ms. Chung Kwok Chun. Ms. Gigi Chang from the Parents Association of Preschool Handicapped Children. For the parents and carers of the severely mentally handicapped, this is really a problem. In March, there were 50-odd respite service places. Why now 248? Well, all new institutions providing residential care must provide respite services. In 2008, there were 33 institutions, now only 38. But in fact, during the period, there are 10 new institutions. There should be more places. And one of the NGO had suspended respite service starting from September this year. Has the administration communicated with them to look into the reason? In this care center of the NGO, my son did stay there, and there's only 1 bed for him. In fact, they have hospital beds, so there's no problem in providing respite services. Why did they stop the service? The government should talk to them. And I did see some students with the mother contracting cancer. So these students need respite services. Well, suddenly the service was closed. That mother was very worried. Eventually, the school fetched a place in a private home for him. And then some parents are Southeast Asian Chinese. The students were asked to go back to their home country to seek help. And just now I read from the administration's paper to the LegCo. It said there that for standing respite places, only 9 institutions are providing them. May I know the distribution of these 9 institutions? What about the rest? When can they provide? Or when will the administration be allocating resources for the remaining institutions to provide the service? For the needy, what should they do? I need some response from the administration. Thank you, Ms. Chang. Next, Civic Party, Mr. Zico Man. Chairman, the Civic Party is of the view that there should be an enhanced provision of daycare and residential respite services for the elderly and the PWDs, such that family members and carers can take a rest every now and then. And the number of places provided to PWD should be categorized into different disabilities: the tetraplegic, the paraplegic, the mentally handicapped, or those suffering from dementia and so forth. And you have to take care of the need of the carers at home. Very often, the carers' normal work is affected because they have to hurry away to take back the elderly or the PWD. So the service hours should be extended. And the application procedures are very complicated. Apart from referrals from social workers and SWD, an elderly above the age of 60 should be able to apply himself after satisfying all the procedures and requirements. And respite services should also be provided to carers also, not just the elderly persons and PWDs. Skills to take care of these sentiments have to be provided. Well, many RCHEs are not charging a high fee for such services, thus bringing too few proceeds to the private RCHEs. So how can we assist them to stably provide certain number of respite places? Civic Party is of the view that the government should allocate resources to these residential care homes so that they can provide a stable number of respite service places. Next, Ms. Phyllis Wong from Department of Social Work and Social Administration, University of Hong Kong. Mr. Chairman, yesterday we submitted our submission to the subcommittee. I hope members have read that. First of all, for carers of PWDs. Earlier this month, in a survey of 846 carers, some figures were worrying. 15% of carers are 61 years old or above, taking care of the carers for 21 years. And some of them had even taken care of the PWDs for over 31 years, 10% of them. 30% of the carers provide caring for 16 hours per day. 80% of the carers have to continue to provide care even when they are not well. And many of them said that they're deteriorating in health. 70% of them were of the view that the respite services are not enough. So the carers are reaching an ignition point. So with just 248 places, it's not enough. So the government must face this issue squarely. Otherwise, the problem may burst. There are 248 respite service places. But let me say a fair word for the institutions. Just now, some friends asked why the institutions are unwilling to provide the service. It's because one program worker at a monthly salary of $8,000 is to take care of 2 respite places. The subvention stayed at $8,000 per month. What about increments, fringe benefits, etc., etc.? All these have not been provided to the institutions by the government. Some institutions were willing to provide the service only on a service basis. But for how long can they go on? So more subvention have to be provided to the NGOs to provide more and more quality respite services. And those with an allowance, they can hire a foreign domestic helper but cannot stay with the family. Say the foreign domestic helper needs to go back to her homeland for 14 days, then the PWDs have nobody to take care of them, particularly for the tetraplegic, for those 14 days who take care of them. So respite services are needed. And there are only 3 places, respite places for the tetraplegic. So there should be a dedicated hostel for the tetraplegic. All the places should be for tetraplegic. So please study the feasibility. Let me reiterate that the independent living mode is the global trend. Carers stay at home to take care of PWDs. This has saved the government a lot of money. In the UK, £27 billion per year have been saved. Has the administration thought of the contribution of the carers? Don't just place the responsibilities on them. That's not fair. So please renew your thinking. If we place more resources on effective respite services, the carers can continue to live with the PWDs, and tetraplegic persons can also live independently. That's a win-win situation. Thank you.
Ms. Hui Ching-yi. I have, my mother is 89 years old, and fortunately she has children who can share my burden. I unfortunately have a 25-year-old son who is mentally handicapped. And during the day, I place him in a day care center. And then I asked my husband that for emergency situations, you should go to A&E yourself. Now I'm not worried about myself. I'm not worried about my son. I'm worried about myself. I think what would happen to my son if something bad happens to me. From what I heard just now, the services are not sufficient. There should be a comprehensive plan. If it's not sufficient to buy 1 or 2 places in a large home, small to medium-scale homes should be opened across various districts to provide respite services. Apart from providing emergency help for carers, respite service can also take the pressure and alleviate the stress of carers. At the same time, the PWDs can also adjust themselves to the residential care home, so that in the future, when they get a place in the RCHD, they can adjust well in the residential setting. This is what the government should do. Thank you, Ms. Hui. Next, from Hong Kong Private Hospital and Rehabilitation Association, Mr. Joe Lee. I'd like to talk about demand and then supply. demand is very keen in Hong Kong as far as respite services are concerned. It's difficult to recruit workers. For workers, well, they work for 6 days and then they get a day off. What about carers? They take care of the patient round the clock and for 365 days a year. There is great demand, and every week we receive phone calls asking for temporary respite places. The traditional Chinese culture has great virtues. Very often when I chat with the parents, very often they blame themselves for the misfortune. They never blame the society for not providing the necessary service and support for them. Why is it that we have keen demand but no supply? The government is unwilling to allocate resources, so no service. What about private sector? No service from the private sector either is peculiar. This is because the government, as of now, is still unwilling to admit that there is a need to provide carers allowance. A couple of weeks ago, I was asked to find a temporary respite place for someone, and I eventually secured a place. And then there was a problem with money. For private homes which offer respite place, it's charged at $150 to $200 a day. So for 10 days stay, that would amount to around or a week stay, it would amount to $1,000. So in the end, they need to utilize the fund, and each teacher chip in some money so that they could gather the sum of $1,000. So for carers at home, they don't get a chance to take some rest. Even if the service is available in the private sector, they can't afford the service. And that is because the government never admits that there is a need to give some subsidies or allowances for carers. The government looks very generous. The government gives $1,000 or so as the monthly disability allowance for the disabled. What about carers? They face many difficulties. The last point is that apart from money, there is also a problem with the care provided. The private homes don't want to provide such service because they are not sure of the health conditions or behavioral problems of the disabled, and they don't know what service can be provided to them, and therefore there is a need to review the situation to provide adequate and continuous service to them. Next, Mr. Richard Lee from the Concerned Group for Services for Disabled Adults. If the RCHEs are sufficient, then RCHDs are sufficient, then the pressure on the demand for respite services will not be so great. In the North District, for sheltered workshops, the waiting time, they are processing applicants in 2006 or 2008 or 2007 in Yuen Long, for example. So you see that they are still processing applications back in 2006 or 2007. So you can see that there is a great demand for the service. And there is the government set up district support centers for PWDs, but they are not sufficient, and only 16 districts have DSCs with limited number of of users enjoying the service, and we are still seeing long queues. If you go to the district support center, very often you can only stay for 1 day or two, and there is no flexibility. You can only queue up at one district but not the other. So sometimes you see surplus of places in one district but shortage in another. And because of the great demand, the homes select their intake, and those who really need the service don't get them. And we suggest that since the service provided cannot really solve the problem, for the district support centers, more resources should be allocated so that the disabled in the community can enjoy the service, and there should be flexibility such that when there is a surplus of places in other districts, they should be able to go to another district. And there should be a direct complaint mechanism or case managers, as mentioned by other deputations, so that the carers don't need to have extra burden on their shoulders, because case managers can help alleviate their burden. Fourthly, the RCHDs are now being regulated. So some resources should be allocated by the government so that places can be provided to those who need respite service. And as mentioned by Mr. Zhou Li just now, there should be resources for carers allowance to provide them with more choices. Thank you, Mr. Richard Lee. Next, Ms. Ling Ching Ha, from Hong Kong Association for Parents of Persons with Physical Disabilities. Our organization was formed by a group of parents of disabled children. We established the association in 2010 and in 2006 in relation to disabled children aged between 6 and 15, and on providing respite places in special schools. The parents on numerous occasions made some suggestions to the Education Bureau and to the government. We think that it is the most we think that special schools are the most appropriate service providers for respite service. The disabled children can be provided with a familiar environment. However, the Education Bureau's response was that it is a non-core work of the Education Bureau, and it should be left to the decision of the operators. And our association finds that for 26 special schools, 6 of them are subsidized by the Social Welfare Department. So we are perplexed about the administration's explanation. Now, from 2008, some respite places are provided in special schools for children aged from 6 to 15, so that when parents become sick or for some emergency reasons, emergency care service can be provided for the disabled children. However, usually these places have full occupancy, such that the parents never get the service. For respite services for children below the age of 15, next year this service will be suspended. However, at the meeting on the 23rd of April, we heard that this service will continue. However, we have yet to know the details of the arrangement, and parents are very worried. I hope that the Social Welfare Department and the Education Bureau will put the interests of parents and the disabled children first and provide respite services in special schools to resolve the problem. So we have several suggestions. The first one is to increase the number of respite places in special schools, and for the disabled, they need the service and yet they don't get them. The other point is that respite places should be provided in special schools so that when parents of disabled children encountered emergency situations, they can get the help they need. And regular, recurrent resources should be allocated to provide this service. And fourthly, for children aged below 15, if the service is to continue, please announce the details to parents as soon as possible.
Finally, from 香港區私營院舍聯會 Mr. Pang. Well, Mr. Chairman, I'm representing our chairman today who is feeling unwell. I've been in the USA for 15 years. I have frontline experience. I'm back in Hong Kong for 2 years. Overall speaking, there's a huge discrepancy in quality of service between Hong Kong and other jurisdictions for private homes and subvented homes. Well, basically, these institutions are to ease the pressure on parents and to supplement the regular services provided by the institutions. On behalf of my clients, I also make telephone calls in order to seek places. Therefore, a central database is necessary. Applications should be uploaded onto the network, and then the places provided should be categorized. Well, mentally disabled is one category, physical disabled is another category, elderly, dementia, etc., etc. And the computer system should be able to show the health conditions of each and every applicant. In the U.S., they have services round the clock, and there are different teams to do assessment. I was also involved in assessment. Some may need to stay in an elderly home, but when they've recovered, they may only need temporary care. Then they should leave residential homes and vacate places for others in need. In the U.S., within 3 days, these persons should be given the service needed. But in Hong Kong, they may have to need for 2 months. They may need to wait for 2 months. And then training should be provided. For example, daycare training provided to parents. In the past, in the U.S., in the hospitals, we did provide training. Here in Hong Kong, we always received complaints from the carers. They need training to learn how to take care of PWDs and elderly persons at home. We should make use of weekends, holidays, and so forth. And we should provide casual carers to take care of patients during weekends and holidays. There should be liaison with universities, for example. Many university students do not know how to provide actual services. So I think you should also have some collaborative work with the universities. Thank you. Time is tight. We should finish at 12:45, but then we need to discuss our future work plan as well. I will not venture to summarize what the deputations and individuals said just now. Time is limited. They mentioned central databases, central referral system, serious shortage of places, and we also heard their personal experience. of some of the deputations and individuals here. So, administration, Mr. Sriu. Mr. Chairman, we listened attentively to the deputations and individuals. Yes, we have a huge need for respite services. As I said at the beginning, in terms of respite services, we don't just attach importance to existing services. Some deputations mentioned those between 6 to 14. Resources have been allocated for the service to continue. I'll leave it to my colleague to report to you the latest progress. As we mentioned just now, we will discuss with the institutions to see whether or not they can provide more respite services, and will actively strive for resources for more residential respite places. So please rest assured that we'll work very hard towards that end. As some deputations mentioned, for the new institutions, we'll reserve places for respite services. We have to understand that for these respite places, apart from casual vacancies, we also need standing places. But standing places need space. In particular, after the relevant ordinance came into force, we have a standard for space per capita. So we do have a strict standard. Given that constraint, we still want to collaborate with the institutions to see whether or not certain places could be reserved for respite service. Some deputations and friends mentioned the difficulty in seeking respite places, be it a central database, a central referral scheme, or a central platform, or whatnot. I'll leave it to my colleague to respond. Whether or not case managers can do anything, we'll keep an open mind. I think the direction proposed is worthy of our consideration. As for private institutions, can they help? Yes, there are a number of problems to be rationalized. For private institutions, we must mention quality. For the institutions with bought places, is there room for respite services, for more respite services? We're only starting with 245 bought places. The number is increasing. The percentage of bought places has been lifted from 55% to 70% recently. This will become a standing arrangement, and will monitor the situation. If there's room for further improvement, we do keep an open mind to see whether or not we can provide more choices to the public. As for a carer's subsidy, as we mentioned earlier, we're closely monitoring the situation. The CCF is also examining whether there can be a pilot scheme for the elderly. Will that be applicable to the PWDs as well? We keep a positive attitude. So we'll closely monitor the progress. That is what the CCF will be doing. As for special schools, when I first came here, Dr. Fernando Cheung had already had in-depth discussion with the Education Bureau. From our standpoint, if space can be reserved for respite services, that would be very good. But we need to obtain the consent of the Education Bureau. And the arrangement proposed must be practicable. I'll once again relay the Deputations' views to the Education Bureau for its consideration. As for the proposed central database, central referral scheme, administrative procedures, and their rationalization, etc., I'll defer to my colleague. Mr. Chairman, once again, I'd like to thank the Deputations and friends for offering invaluable advice to us. Well, some information first. Just now, some organizations said that 6 special schools are subvented by the SWD, but they are different from schools for PWDs. They're basically for students with special behavior. So they're different from institutions for PWDs. And just now, some parents were worried about those children below 15. We've already informed our service providers that the service would not be terminated. It would continue. We'll send letters to them. We'll also inform parents' associations. Please rest assured that the service will not be terminated. And just now, parents asked about the distribution of students between 6 to 14. Hong Kong, 14 places. Kowloon is 30. West Kowloon, 12. NT, Sha Tin, Tai Po, and North, 24. Tsuen Wan, Kwai Chung, Cheng Yi, 28. And then Tuen Mun Tin, Shui Wai, 14. Altogether, 122 for those between 6 to 14. Parents said that there's an acute shortage. Yes, that's a fact. But we have integrated rehabilitation centers with a higher degree of care because there's this concept of integrated service. So for the seriously handicapped, these places can serve them. If individuals have problems, they're welcome to contact us. We'd like to understand what problems they have. And just now some parents said that individual institutions had withdrawn from the scheme or service. Yes, individual institutions might have operational difficulties. We respect them. At the same time, some other institutions joined us. So we would like more institutions to join the service, in particular that provided to those between 6 to 14, that's those below 15. Let me respond to a number of issues raised just now. First of all, I'd like to affirm that there's a shortage of service. For the department, strategically, we have adopted a 3-pronged approach. Number 1, for this shortage of respite places, we'll actively strive for resources for additional places. That's what we must do. As for those with serious disabilities, there's also an acute shortage of places. In future, when we have additional places, we'll consider the allocation of resources, and this factor will be taken into consideration. That's for residential care, number 1. Number 2, daycare. For the PWDs and elderly with a medium degree of need. So we'll see whether we can enhance our service. Our placement centers are rather saturated. So we'll see whether we can have additional service points. Number 3, for those with serious disabilities like the tetraplegic, existing respite services may not suit them. The best service is home care, that is, service provided at home. We're now discussing with some parents' associations. Our daycare services have been rationalized in March this year at a funding of almost $200 million. So we try to provide respite services at home. Now, this is an experimental scheme mainly for those above the age of 15. In future, we'll go beyond that. For all those with serious disabilities, including students at school, if they have a need during holidays, for example, we'll provide respite service at home. Now, this is a three-pronged approach. Home care is already implemented, and if we can increase residential and home care services, if we have extra resources, we'll actively proceed with these three approaches. I hope with this three-pronged approach, even though we may not be able to fully solve the problem can be hugely relieved.
Well, a suggestion about an online platform is a very good one. We are considering this idea, but the biggest challenge is how we can update the information on a daily basis. If so many organizations are involved, there will be administrative costs and manpower implications. And we need abundant resources to have instant update. If the information is not up to date, then we are going to receive lots of complaints. And in the end, you may just continue to making numerous phone calls. So we're thinking together with organizations, how this can be improved if we're to implement the service. If the information is not up to date, it may not be helpful for users. So we need to understand the constraints before we implement the measures. And some talks about the application procedures. And as we understand it, the procedures are simplified. But at least we need some form of assessment. Different homes take care for different PWDs with varying degree of disabilities. So we need to match the homes with the degree of disability, and we try to simplify the procedure. But we need to assess the degree of disability of each applicant. This is just being responsible. And the deputations, as well as the commissioner, mentioned the point about case managers. Some of the deputations here might have attended meetings with us, and this is also an idea that we are contemplating. If we have new resources, we will as soon as possible roll out this initiative in different areas. But we need to accord priorities. Perhaps for those with more severe disabilities, we might need to look at the situation, but we will continue to liaise with the groups and organizations, and will continue to seek views from you. As for carer training, we all along attach importance to carer training. As mentioned just now, for home care services, it will be regularized. Apart from providing home-based care service, we also wish to provide carer training. Next March, when the service is regularized so that it covers the whole territory, we will discuss with the service providers and see how this scheme can be improved. And again, views from deputations here, in particular parents, will be sought. Some mentioned whether the 14-day rule applies. Yes, it is stipulated in the rule that 14 days is the limit. But we also asked the service providers, and some admit that some users stay for more than 14 days, and would like to thank some service providers for allowing flexibility, and I'd just like to point out that we are not that rigid. We also want to provide flexibility for service providers. However, one point to note is that for respite services, they are provided on a temporary or short-term basis. If long-term care is required, you might need to consider other forms of care service. Yes, you need to respond to services for the elderly. But before Mrs. Chan responds, I'd like to seek members' views. I think we should extend the meeting by 15 minutes. The meeting is scheduled to end at 12:45, but I think I'll extend the meeting to 1 o'clock. Mrs. Chan. Chairman, I agreed. I also understand that time is short at today's meeting, so I'd just like to give some brief responses to services for the elderly. Now, for residential respite services throughout the territory, as said in my opening remarks, apart from the 11 designated centers for subsidized places, including subvented homes and also places on or homes on the board the enhanced board play scheme, when there are window periods with casual vacancies with existing resources, we'd like to provide temporary respite service. Mr. Lee has left. Mr. Lee would like to know about the utilization rate, and I do have some information here. From 2011, 2012, and 2013, as far as the places in subvented homes are concerned, the utilization rate was up to 60%. The enhanced for private homes with board places, the scheme of providing respite services started only in 2012, and the utilization rate was roughly 400 elderly users. From 2012 to 13, that's the utilization, not utilization rate as such, Chairman, I'm sorry, but I have the number of users, and this is the information at hand. As for support for carers, I think in previous meetings we already made this reply, and time is tight here, so I won't repeat the answer. So, questions or comments from members? Mr. Cheung Pok Chi? Dr. Helena Wong is not here. Now, Mrs. Chan talked about the utilization rate of 60%. It is obvious that there is a mismatch here, because I think the rate is low. Users need to make numerous phone calls because you don't have a centralized hotline. Chairman, I think we are not concerned about the casual vacancies. We are concerned about the number of places actually, which are actually standing places for elderly and PWDs. For children between 6 and 14 years old, there are only several of them. Now, I have a bold suggestion, Chairman. I suggest that in Hong Kong, Kowloon, New Territories West, and New Territories East, the number, an additional 25 places should be provided in each district or each region, as mentioned. According to Mr. Lee, just now, for private homes, the fees are $200 a day. So, if you do some calculations, it's just $9.125 million. And then the government can already pay for the fees of 100 places for a year. And you can charge users for part of the payment, so that if you want to resolve the problem, it will only take around $6 million, and then the places provided will be close to the homes of users. Is it possible, Mr. Siu or Mr. Fong? Any response? Now you talk about striving for resources to increase the number of places. Yes, this is definitely what we are undertaking. We will strive for resources. And my SWD colleague can supplement this. When we talk about places, we need to find suitable places first. Chairman, this is a short-term suggestion. In the long term, if you can earmark a site for new homes, then you must reserve at least a floor for respite places. The other point is that you don't have new homes today, so you can buy places from private homes. It will take less than $6 million. Will you do it, Mr. Siu? Apart from existing homes, we discuss with service providers and see if they can provide more places for respite service. And we need to strike a balance here. The space is limited. Whether the place should be provided for long-term residential care or for respite care, there is a choice to be made here. We understand that the waiting time is long, and yet we need to consider for long-term residential care, the waiting time is equally long. We need to strike a balance. And thirdly, as said just now, we have the enhanced board place scheme for the private sector. This is only the beginning, and we have increased the cap from 55% to 70%, and the scheme will be regularized. And we do keep an open mind, because if quality respite places can be provided to parents, that we are willing to consider this suggestion. So you can't answer Mr. Chan Kwok-chi's suggestion. I need to impose a time limit, 4 minutes each. I'm sorry, just 3 minutes perhaps. Mr. Pun Siu Ping. Thank you, Deputations, for expressing your views today on the demand for respite service for elderly and for PWDs. The demand is keen. This is sure. And I have a couple of questions for the administration. First, does the administration have any information on any study on the demand for respite places in different districts? Mr. Sui said that he would discuss with organizations and service providers and strive for more resources. Has the government set down any timetable? What is your estimation on striving for resources? You talk about a three-pronged approach, but have you any specific timetable? Mr. Siu. Now, in short, yes, we cited some figures on the supply side, but as far as the demand is concerned, it is difficult to gauge. Yes, the SWD does have some information, but it may not be. It may not reflect truly the reality, because sometimes you may make phone calls and then you might not get a place. So I think we need to ask the SWD to further consider how the data can be collected. One thing is sure, that we understand that there is a keen demand for the service in the community. The other point is that it's a rolling program or rolling initiative. So it's a three-pronged approach. For existing homes where space allowed, we will try to strive for more resources. And we also have a mechanism under which every year we can strive for more resources. And we hope that some improvements can be made in this regard. And thirdly, there are designated respite places, and this will be a policy initiative which will continue. And as said just now, apart from residential respite places, we also need day respite places. And in daycare centers, they also offer such places, which is very helpful. And we are considering whether more places can be provided by daycare centers. This is what we're actively looking into. Mr. Poon's question was that in the coming RAE or budget under preparation, how many places specifically are you going to strive for? Please tell us. In the RAE, we can only release the specific figures when the budget is announced. I can only say that we're actively pursuing this. Mr. Leung Kwok Hong, Chairman, you also have the confidentiality principle. You can't tell the government how much money you're going to ask the government for.
First of all, we have to be very serious and solemn about this. The administration always says that it wants to do a lot of things but has no resources. $20 million were mentioned. Well, what percentage is this when compared with, say, 2,500 trillions? Now you have an envelope system. Your bureau has an envelope. Well, if the envelope is sealed, how are you going to compete for resources within the bureau? You didn't mention that. Mr. Leung, that's something old. Well, they said that they're going to strive for more resources in future. They said they couldn't tell us anything now. That's for the future only. So, in what way is this meaningful? That's number one. Number two, I have to say a few words on behalf of the needy, to be fair to them. Now, this situation is the result of poor policies in the past. It's not your fault. There are so many elderly persons, so many PWDs, and so many elderly who are ill. Now, this is the bad consequence. Now you're asked to cope only. Cope only. Respite services, home-based care, center-based care, etc., etc. You are only talking about a triage system. You just want to stream the patients. You mention home care. Ask Dr. Fernando Cheung if a person is wheelchair-bound, but if no PRH unit can be allocated to him, what should happen? Do you want me to do filibustering again? If they are not going to promise anything, I can do filibustering. What about Matthew Cheung? Does he have any policy? If there's a policy, we'll see why Leung mentioned target-based. All right, you cannot make known your strategy. So what can be disclosed? Very simple. Your bureau director or you, after telling society the existing situation, what objectives do you have? Tell us your strategy and then come for money. We'll definitely give you the money. We have videotaping here. Next time you come, we'll give you the money. We have a great deal of money. Do you want it? Can you promise that the three main pillars, respite, service, residential care, etc., etc., tell us how much you need, how many places you are going to provide. Chung Kwok-chi asked you a question and you mentioned the bought place scheme. You have to talk to the market. That's already not ideal. Ask them to upgrade their service, and then you can buy places from them. Otherwise, even if you have money, you won't have any place to buy. Will you have money to buy bread, but the bakery downstairs doesn't know? You don't tell the bakery that tomorrow there will be 50 more customers, so please bake more buns. Leung Kwok Hong has already presented his views to you. Please try as soon as possible, strive for resources in the budget. We, of course, want to have as much transparency as possible. But now you're telling us that the details cannot be disclosed, but we have to follow up on a number of aspects. Well, very simple. The central referral platform. Just now, Mr. Fong said that there might be some technical difficulties. Frankly speaking, nowadays, even if you want to make a booking with a restaurant, you can do it online. You know how many places are left, and you can queue up. You can be given a waiting number. In fact, on your way to the restaurant, you'll be able to know it's about your turn. Even restaurants are able to do this. There's no reason why our SARG cannot do it. Even for our members' ward officers, we receive a case, we have records, we upload the records to the platform. Any staff member can use the computer anywhere to obtain the information. So technically it's feasible. This is only low tech. No, it's not about technicalities. They say that they have not enough staff to monitor the situation. Well, these are subvented respite places. Ask them to immediately, well, not immediately maybe, within one day, when there's any change in the number of vacancies, the information online should be updated. And certain vacancies are known in advance. Say, for example, tomorrow there's going to be a vacancy. You won't know it today. So ask them to update the information within a day. I don't think the NGOs will say that they're not able to do that. So within a time frame, say within half a year, can you set up such a central referral platform? At the same time, we'll be able to see the demand. There are so many people, so many institutions. Day after day, they're making telephone calls. Is it a waste of resources? Would you rather waste such resources than setting up an online central referral platform? Is it possible? Mr. Fong? Mr. Chairman, we said that we would do it, but just now I brought up some technical difficulties. So, at this moment, I'm not in a position to say when we're going to be able to set it up. We have to do consultation. We need support from a number of parties, etc., etc. But we'll study this. Well, I know that you've studied the feasibility for quite some time. You do want to do it. Have you got a dedicated team to study the matter? Or is it still a concept in your mind? Well, we have done some advanced preparation work. Still, we need to resolve certain technicalities. We'll follow up on the issue. I think we have to set a time frame. You are unwilling to set a time frame for this subcommittee. We hope that in 4 months' time, you can report back to us the progress. Agree? Yes, I agree. For the PWD children between 6 to 14, parents find it most desirable to provide the service at school. will write a letter to the Education Bureau requesting them to follow up on the special schools. It's most ideal for these children to receive respite service in their own school. I understand that Mr. Sui will also refer this request to the Education Bureau. If members do not object, I'll also write a letter to the Education Bureau. And then for the lottery fund, the respite service will be maintained up to the 1st of April next year. That's the original schedule. Now you're going to continue the service by using your recurrent resources. I understand that some NGOs have withdrawn from the service, but you mentioned new NGOs joining. For this year, overall speaking, has there been an increase or a decrease? At the moment, you have a voluntary scheme. The NGOs volunteer to provide the service. If they're unwilling to provide the service, you cannot force them. For children, the number of serious cases is rather low. Only 38 places for the seriously disabled children or mentally handicapped children. And we have parents here. Ms. Hui is from a single-parent family. Well, if she's ill, what should happen? Can we have more information and figures? Mentally handicapped. According to a record, places for the seriously mentally handicapped for all ages, 93. 38 for those below 15. Right. Well, let me have a moment. Sorry, the speaker is not coming through. Will they base their remarks on your information? Well, it doesn't matter. The discrepancies won't be huge. We'll follow their data. Now, we do have certain centers that can provide a higher degree of care. They can take care of the more serious cases. So I appeal to the friends here to contact those centers. We all know that there's a huge demand. But very strange, the usage rate is on the low side. Even for the elderly, the usage rate is only 60%. For the homes, we're told that the bought place homes don't really want to provide respite service because even if they do so, that's not to be included in the bought services. So even though they have vacancies, they're unwilling to let people use those vacancies for respite services. Mr. Chairman, for the bought place homes, oh, sorry, it's almost time for us to finish. Can I have another extension of 10 minutes? We'll finish latest by 1:10. Mr. Chairman, for the bought places, as you and those who are here know, for a bought place, the elderly has to go through a medical examination. If we find it necessary, we'll arrange a place for him. If respite service is needed, no assessment is required. For respite service, as far as I understand, my colleagues may supplement, if the person has not contracted a seriously infectious disease, he can apply for respite service. You mentioned that some homes want to include the respite service provided into the board place services. I believe there's a degree of difficulty here because we're not talking about the same group or category of elderly. As for incentives, some institutions just now mentioned respite services provided by private homes, not in the board place scheme. I really have to go back and study the details because a lot have to be examined.
Just now, you also mentioned that for day respite services or respite service in private homes on the SWD's website, we do provide update on this matter. So you can check our website, which updates weekly. I think when we talk about a platform, we're not talking about weekly updates. We're talking about daily updates. For the underutilization of respite places in private homes under the enhanced board place scheme, according to the deputation just now, the utilization rate was very low as 10%, and you said that 400 users, there were 400 users. But what about the overall picture? Please provide this information to us after the meeting. Emergency situation. If PWDs or elderly people or people with severe physical disabilities, if they need emergency respite service, for people with severe physical disabilities. According to Ms. Wong just now, there are only 3 places. I don't know how many places. And can you tell us what can be done if there are emergency situations? Mr. Wong, on elderly. Thank you, Chairman. Emergency respite service. Apart from respite service, if there is any emergency need of the elderly, for example, if the elderly people have family problems or other emergency situations, the acute respite service can help them. And we have a number of LCGs providing this service in Hong Kong. And we also have places in care and detention homes and nursing homes. And for designated places of this nature, we have 65 of them in 23 subsidized homes. Thank you, Chairman. So what about the utilization? According to some preliminary information, there is room to accommodate more users. For example, for this month, for these 65 places, taking a snapshot of the situation, in fact, this information is available online. 48 places were utilized with a rate of 74% or so. So there is still room to accommodate more users or to meet the demands. Mr. Fong. We haven't collected data on emergency cases. That depends on individual cases. As for community-based support, for example, district support center, we have daycare center and day activity center, and we have some NGOs providing daycare service. So it depends on the case, and also for home-based care service for PWDs with severe disabilities and urgent needs, they can utilize the service. This is a pilot program. It will be extended to throughout the territory in March next year. We can provide home-based care support for them. I think this can help the majority of PWDs. Some views from deputations, 1 minute only. Mr. Seal said that on respite service in schools, they will discuss with the Education Bureau. But let me supplement. Over the past few years, some parents might need to go through operations. They might become sick, and there was a need for respite service on a short-term basis. If, however, if the child wasn't originally residing in the residential place in the school, then the Education Bureau could not offer any help. So please remind them. Sometimes I still see parents having this need because they become sick or because they need to undergo an operation. And the SWD couldn't help the child in getting short-term respite service. And as a result, they can only find long-term, or the SWD can only help them apply for long-term residential places. They meet the criteria, so they can get the place. But in fact, you can discuss with the Education Bureau. It's not a waste of resources. Thank you, Mr. Yip Kin Kang. Please turn on the microphone. To respond to Mr. Fong, he talked about acute respite service or day respite service. Now, if social workers can't find such places, then can you tell us what alternative we have? Is it hospitalization? And we understand that for the home care service team, there is also a shortage of manpower. So we all understand that the service provided is limited. And in response from Mr. Fong, I can't say whether hospitalization is an alternative. That depends on the patient's needs. But if there is a need, the community support home care team can provide tailor-made service. So you can liaise with them, and we can utilize the service. I'm talking about home care service, but they're not. They won't stay there overnight. Now, you can tell them in advance, should there be any special needs, they can make temporary arrangements so that during weekends or on Sundays or even at night time, service can be provided. Still, they're not staying overnight. Providing care at home. Of course, the number one criterion is that you can't find a place in any of the homes. So you just first of all need to try the homes. If not, then I think the home care service should be able to meet the need, or should at least be able to help. That would be a special arrangement. You need to discuss with them, and I don't think it is difficult in securing the service. All right, time is up for today's meeting. The discussion should end here, but we're all clear that the elderly people as well as people with disabilities are facing difficulties when their carers or their parents are otherwise engaged, or in emergency situations, or in order to relieve their stress. It is difficult to obtain respite service. Supply is short, and at the district level, supply is not sufficient. So I hope the administration would consider the comments today and would do something to set up a centralized platform and to enhance transparency. Many people talked about a carer's allowance. I hope that apart from carer of elderly people, you can consider carers of people with disabilities. Increasing the number of places. Please strive for resources and also to provide more day respite places. If there is a demand for temporary and short-term care service, then the CCF may be utilized to help family members obtain the service. And that includes private homes. If they meet the criteria, or perhaps some neighbors or close friends who can take care of the family. This can help them tackle the problem, and many deputations have come today and expressed their views. I hope the administration will consider them. We still have one item on the agenda. We have a number of tasks to complete, and that's item 3. We'd like to extend the work of this joint subcommittee to 13-14. We have a number of subjects to discuss with the administration. The paper has been forwarded to members. Mr. Chiang Kwok-chi. There are 12 items in the paper. I think we can have discussions on all of them. We have 12 items at least. We should ask the administration for follow-up. But our subcommittee will only run for 9 months, and I think we should at least have 12 meetings. And I think the committee, and I agree that the committee should run till July next year. So we get, I get the members' support, right? So date of the next meeting. Next meeting, we are going to discuss the need for dementia patients. So much for the meeting. Meeting's adjourned. Thank you.